Welcome back Sunbro. We hope you all in great health and great money. Before we start, please at least subscribe so we can have little money for food and paying bills. Alright, today we are going to talk about top 12 causes of arm pain you shouldn't ignore. Arm pain can have many causes. Understanding the signs can help you know when to rest, treat, or seek medical help. 1. Heart attack. Arm or shoulder pain, paired with chest pressure, shortness of breath, or discomfort in your jaw, back, or neck, could signal a heart attack. Symptoms can come on suddenly or gradually. Call 911 immediately if you notice these signs. 2. Carpal tunnel syndrome. Repetitive motions like typing or gaming can inflame the carpal tunnel, pressing on the median nerve. This causes forearm pain, numbness, tingling, or a weak grip. 3. Tendinitis. Repeating motions, like using tools or playing racket sports, can strain tendons and cause burning pain or weakness, especially during movement. Rest and ice can help. 4. Sprain. Falls or hits can tear ligaments in your wrist, elbow, or shoulder, causing swelling, bruising, and trouble moving. Treat with rice, rest, ice, compression, and elevation. See a doctor if it's severe or not improving. 5. Strain. Overstretching muscles or tendons can cause arm pain and weakness. Rest and ice for 48 hours, and consider physical therapy if pain lasts more than 2 weeks. 6. Dislocation. A fall or impact can separate bones at a joint, often in the shoulder or wrist. The area may look deformed, swell, or feel numb. The doctor can realign it, and you may need rest, ice, therapy, or surgery. 7. Stress fractures. Repetitive motions like throwing or hitting can cause tiny bone cracks. Pain worsens with activity. Rest for 6 to 8 weeks to avoid serious damage. 8. Broken bone. A break causes sharp pain, swelling, and bruising. The doctor may use a cast or, for severe breaks, surgery with screws or pins to fix it. 9. Bursitis. Repetitive motions like lifting or throwing can inflame bursa sacs, causing joint pain and limited motion, especially in the shoulder. Rest, ice, and anti-inflammatory meds can help. 10. Impingement. Rotator cuff inflammation from injury or overuse causes front shoulder pain. Rest, ice, and physical therapy can ease discomfort. 11. Herniated disc. A herniated neck disc can press on nerves, causing pain, numbness, or weakness in your shoulder or arm. Pain may worsen with movement, coughing, or sneezing. 12. Osteoarthritis. Cartilage wear and tear causes joint pain, swelling, and stiffness, often starting in middle age. Splints, anti-inflammatory meds, and light exercises can help maintain joint movement. If your arm pain persists, worsens, or comes with other concerning symptoms, don't ignore it. Consult a doctor to ensure proper care. Thanks for watching, Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting, Sunbro.